CONNECTpreneur is a global community of over 30,000 investors, CEOs, entrepreneurs, business leaders, and professional service providers from around the world. And over the last 13 years, we've hosted over 100 in-person and virtual forums. And we appreciate your guys' support and showing up and meeting with our presenting companies, investing in them, and so on. We've also built an investor community with over 4,000 accredited investors, qualified purchasers, other private investors, angels, and family offices. They've attended our events, and they're interested in investing in some of the awesome deals that they can meet through our platform. And our database now exceeds over 500,000 technology business leaders and investors from around North America. About 2/3 of our presenters have received funding through the platform. So bottom line, if you're raising capital now or in the near future, let's talk about how our platform and community can help you. Hopefully, you've already downloaded the program book for today, which has information on our awesome sponsors, the executive summary of our 11 tremendous presenting companies, as well as a list of all of our RSVPs. And if you have not downloaded it yet, don't worry, our team will post the link to download the program book into the chat box. Speaking of sponsors, I would like to thank them because they're the ones that make these events possible and free. And Sky, if we could put up our first sponsor poll, this is to support our sponsors. If you have a genuine interest or requirement for some of their services, please click the link. These are confidential. We'll only share your information with them, but I do want to shout them out by name. We have a page in the program book with all of our sponsors, but I want to thank Next, powered by Shulman Rogers. They have an amazing product for early stage company called Next Raise, which supports entrepreneurs everywhere. It's a new holistic approach incorporating a bunch of different technologies to allow companies that are in the seed to Series A stage become investor ready. So check out Next Raise. I want to thank Modus Create, one of the world's finest digital transformation companies. AEG, the Association for Enterprise Growth, leading network and community of service professionals in the Baltimore and Washington areas. The Prince William County, Virginia Economic Development, Shulman Rogers, Northern Virginia Chamber of Commerce, the Maryland Tech Council, Refraction, which is the top co-working community in Washington, D.C., where we have our CONNECTpreneur Lounge. It's a free, you can use it for free twice a month. It's a big space with lots of cool stuff. So check it out if you're in Northern Virginia. Let us know if you're going, and we will make sure that you are able to access our lounge. Startup Grind, Entrepreneurs Organization, Frederick Innovative Technology Center, Keiretsu Forum, Blue Venture Investors, Dingman Center Angels, Citrine Angels, the MIT Alumni Angels, the New Jersey Angels, Georgetown Entrepreneurship Initiative, the Wharton DC Innovation Summit. I want to thank Founder Institute, Ryan and Wetmore, Enterprise Transformation Solutions, and Monty Jade Science and Technology Association. Thank you guys so much. And also thank you for filling out the poll, and we will definitely send those on to our sponsors. I do want to have some program notes here. We have some events coming up in person and virtual. Check out our brand new website. It's only like a month or two old, and we have a lot of our events on there. So we have master classes, private investor fundraising meetings. We have these virtual meetings. We have in-person CONNECTpreneur forums. Speaking of which, the next one is on the evening of December 19th in Tyson's Corner at Vallow Park. That's an evening event. So if you're in the region, please come in and join us. We have our next virtual rocket pitch, which is today's meeting, is December 19th at 11 o'clock Eastern. If you guys find yourself in San Francisco for the JP Morgan Investor Conference, we're hosting an investor brunch on January 12th. That's Sunday. So we'll put all that information is available on our website, by the way. And then we have Connect Tales, which is our sort of quarterly cocktail party. We have one on January 28th, I believe, in Arlington, Virginia, and Emily will post all the information on there into the chat box so you can find out more and register. If you're interested in sponsoring at any of our events or presenting or speaking, please let Skylar or one of our teammates know, and we'll get that info to you. And last note I want to say is, and I know Sky is going to cover this very soon, but we're polling our investors after each of our 11 presenting companies, and these are confidential polls for investors only. So if you're not an investor, please X out of the poll. You don't need to answer it. And those, for the investors, that those responses are 100% confidential. We will only share with the presenting company. After the 11th presenter, we will do a final poll and then go immediately into breakout rooms. Each room will be hosted by one of our presenting companies. Just please remember that it's their room to answer more deep dive questions or to set up follow-on meetings. So please respect that. We appreciate everything you guys are doing. For me, I want to wish everyone a happy Thanksgiving. And I hope you and your families are safe and enjoy the holidays. And with that, I'd like to turn things over to our MC, Skylar Rallison, who is our community manager. Welcome, Sky.
Perfect. Thanks so much, Tian. I know Tian mentioned a lot of the notes for today. I just want to reiterate that the investor polls will be going up after each presenter, and please only answer those polls if you are a direct investor and a direct investor only. We do not want service providers nor anyone who is not a direct investor to answer these polls. So once again, that is direct investors only to answer these investor polls. So with that, I would like to get started. To introduce our first 6 presenters, I'd like to introduce longtime CONNECTpreneur partner, Sarah Cosper, who's an associate with Next, powered by Shulman Rogers, which is disrupting the way startup law is being performed with packaged offerings and a fixed price basis. Next has been selected by Law.com and Legal Week as the Startup Emerging Growth Law Firm of the Year, beating out several huge law firms and very well-known law firms. So with that, I would like to say congrats and welcome, Sarah.
Thank you, Skylar. Good morning, everyone. Thank you, Avery, Emily, and Tien, and the whole CONNECTpreneur team for today's great event. We are very honored to be a longtime sponsor and supporter of CONNECTpreneur, a leading global event connecting entrepreneurs, investors, and all other members of the startup ecosystem. A quick word on Next. Next, powered by Shulman Rogers, is a new innovative model for the delivery of legal services. We support a company through every stage of their growth, from launch to exit, and we've designed our program to be from an entrepreneur's perspective. This means we offer predictable and reasonable legal fees by productizing them in fixed price packages. But at the same time, we still ensure that our clients work directly with our seasoned expert attorneys through our hands-on legal services model. And we also integrate a robust technology platform that creates a client-centric experience that is collaborative, efficient, and transparent. I'm going to move to our first company today, Alphen Biologics. Alphen is using a new class of multi-target therapeutic drugs to develop dermatological therapies with fewer side effects, but greater effectiveness and patient tolerability. Please welcome Neil Kohler, Chairman and CEO.
Good morning, everyone, and thank you for taking the time to listen. This morning, excuse me, I'm going to tell you about the largest dermatology problem in the world, perhaps the largest therapeutic problem in the world, atopic dermatitis, or some of you know it as eczema, and how our company is poised to dominate that market and be the next billion-dollar drug treating atopic dermatitis. This is atopic dermatitis. On the left, you see the redness around a little girl's face. This is after 11 months of treatment before our drug. And on the right, you can see after only 17 days, all of the AD is resolved, and there's even a little bit of a smile peeking through. This is what we've seen in our clinical trials. The market is huge. We have factored in sell price for each of the major markets, factored it down all the way down in China, for example. We factored in access to healthcare in each market, and we still come up with each of the major markets, multi-billion-dollar markets, which point to the ability to do regional exits or a global exit. That's very, very attractive, as you'll see in a little bit. We've completed our phase 2A clinical trial program. We'll be raising money now to do our phase 2B clinical trial program. These are the results of the phase 2A. Focus on first the darker green boxes and then the lighter green boxes. Darker green is where we were most effective. Lighter green is where we're almost as effective as everyone else. We were the best at treating the top priorities of atopic dermatitis. We're the only drug that treats the critical priority of atopic dermatitis. And then we did very, very well treating the standard inflammation component of atopic dermatitis. As far as regulatory status goes, we've done our first set of clinical trials in Australia. We need to simply file an update notification, and we will be ready to start our phase 2B clinical trial in Australia in February. In the US, we've submitted our IND, investigational new drug application, to FDA. We've gotten a terrific, constructive, supportive response. We're on track to start the phase 2B clinical trial in the US in March of next year. In Europe, the same thing. We're on track to start in March of 2025. The difference between the phase 2A and the phase 2B is fairly simple. We did a total of 60 patients in the first trial that I showed you the data for. This time, we're going to do a total of 200 patients. We're currently raising a Series B round. We've got an $18 million round, of which $8 million is already in the bank, so we're looking for $10 million more. We funded 2 of the 4 critical milestones already. Our phase 2B trial is being broken into an Australia piece and a US and European piece. We have funded the Australia piece, 60 patients. We have funded to the tune of $4 billion at sales value drug raw material supply. And 2 yet to be funded is the phase 2 trial for our second drug, which I won't talk about here, epidermolysis bullosa. And we have to fund the US and the EU atopic dermatitis phase 2B trial. What could an exit look like? Well, there are 3 terrific exits, recent exits. Amgen, Sanofi, and Johnson & Johnson did license deals or acquisitions. All 3 of those were over $1 billion in transaction value. All 3 were at the end of the phase 2 trial, where we will be at the end of this raise. And my slide deck is for, there we go. So what could the return look like for this round? If we did the same deal Sanofi did, it's a 25x on our Series B. We did the same deal as J&J did, it's a 22x or 20x. If we did the same deal Amgen did, it's a 22x. My background, half of career is life science, large pharma, second half of career, all early stage. Last exit is 16x. And I think I'll end it there.
Next, we have Braveheart Wireless. Braveheart is building an extensive at-home chronic care monitoring system with an initial focus on cognitive heart failure. Please welcome Steve McCalmont.
Thank you, Sarah. Again, I'm Steve McCalmont, CEO of Braveheart. My background's in cryptography and analytics, and I founded multiple successful enterprise analytics companies. I never thought that I was going to be in the medical technology space, but Braveheart was born out of necessity. My elderly father suffered decades of cardiac issues, and I watched him suffer unnecessarily because there's no way to continuously monitor his vital signs at home. We managed his heart failure through the emergency room, which is the current standard of care. And, I knew there were other devices out there like the Zeo patch, but they really couldn't deliver what was needed to keep my father at home. Once we enabled my father and his cardiologist to see his vital signs in real time, we dramatically improved his quality of care. In fact, we kept him during his palliative care process, we kept him out of the emergency room at least 6 times. What I didn't realize at the time was there's 84 million people in this country with multiple chronic diseases, and they could all benefit from this platform. And there's been a 30% increase in cardiac events over the past 3 years and it's broken the healthcare system. Like I mentioned earlier, the patients are being managed through the emergency room. There's a severe staff shortage and high levels of readmissions, particularly around congestive heart failure, all resulting in the hospitals losing millions of dollars. Most at risk are the rural hospitals, with in fact many are slated for closings. So what's needed is a new care delivery model. This care delivery model is a platform to give an early warning to clinicians about their patients' decline at home. With the early warning, they can have a proactive intervention that is less costly and keeps them out of the hospital. Very important in this space. How we've done it is actually through the wearable. You can see me here wearing it. It's worn on the chest. All that data is live up into the Amazon cloud. That's me. And our AI algorithms, particularly the AI on the edge, is what allows Braveheart to personalize the algorithms and to get that prevention to the point where we're keeping the patients out of the hospital and, in fact, caring for them better than if they were in the hospital. Along this path, we've had multiple issued patents. Most recently, a AI novel arrhythmia detection method that in itself could turn the medical technology industry upside down. So in summary, we're a force multiplier platform for clinicians to manage their patients at home better than if they were in the hospital. Braveheart's going after a $2 billion segment of the $62 billion high growth telemedicine market. Our achievements to date on our seed round are notable. Built an experienced team, issued patents, first FDA clearance, beta customers, investments from Johnson & Johnson and ADI. And again, this was all on our seed round, very capital efficient in this effort. Great team, incredible depth and breadth in the medical technology industry, board and advisors as well. Very proud of the fact that they've been incredibly hands-on with our product development strategy as well as our go-to-market strategy. The ask today is a Series A extension of $10 million. With this, we will continue our AI algorithm optimization studies, expand our commercialization efforts, and drive our go-to-market strategy. Thank you, and I look forward to talking with you in the breakout room.
Next this morning, we have 2020 Gene Systems. 2020 Gene Systems is a clinical laboratory test developer that is focused on AI-powered blood tests for the early detection and prevention of cancer and chronic diseases. Please welcome Jonathan Cohen, CEO.
Thank you very much. I'm here in our lab, a clinical lab, just outside of our nation's capital in Washington, D.C. We focus on the early detection of multiple cancers. And we are right now the #2 market leader in the United States. We compete with a company called Grail. And our test, which is getting quite a bit of traction, has 3 main competitive advantages. It's more affordable, easier to access, and more accurate for early stage cancers than all of the leading competitors. Let me begin with accuracy. So studies both at the MD Anderson Cancer Center and one that we participated in earlier this year at the U.S. National Cancer Institute demonstrated that our test is very accurate for early stage 1 and 2 pancreas cancer, ovarian cancer, prostate cancer, and lung cancer, better than the DNA-based tests. Our test is based on protein tumor markers, not DNA, and it allows us to use automated analyzers like the one over my shoulder behind me that can be done, and they're robotic in nature, and it allows us to do it much faster and more affordable than the competitors. So Grail's Gallery is just under $1,000. Our test starts at $200. The other thing is we can use smaller quantities of blood that allow us to use devices like the one you see on the right side of your screen that painlessly tap about a half a milliliter of blood, about 8 drops from the upper arm. So we have now moved to at-home tests, at-home collection. So people collect the specimen at home, send it to the lab where I'm at right now, and we return results in about 3 business days. People love it. About 70% of our customers are opting now for at-home rather than testing in clinics using traditional venipuncture, which is the large and painful needle. Our market in the United States includes both employers, occupational health, high-risk employers like fire departments that have employees at higher risk of cancer, and we have a robust and growing direct-to-consumer market as well. We also license our AI-based algorithms to lab chains throughout East Asia, in particular Taiwan and Japan. So we have, in that case, software as a service business. Testing can be done in country, doesn't need to be sent to our lab. So we have 2 spheres of commercial activity going on. Right now, we are seeing more than double year-over-year revenue growth. We'll do a little over 2 million this year, 5 million next year, high reorder rates, and a line of sight to profitability. So again, we'll do about a little over 2 million. This is our actual revenues, and it continues as far as the eye can see. So we are doing right now, we're raising money both on WeFunder. We've done very well over the years with equity crowdfunding. If you're interested, you can go to WeFunder. The page is shown here. For investments really under 20,000, for those over 20,000, we're doing a $10 million convertible note. We have 2 right now discussions going on in the M&A world, one with a very large Fortune 500 company. We get inquiries quite often now. We also have an engagement with a seasoned investment bank, and we will explore the IPO markets in the new year. If they return after a hiatus of 2.5 years, we will be ready to explore that opportunity as well. So I think we're a company for investors that might not be wanting to wait years and years for an exit. We have both an M&A opportunities as well as the IPO markets. If you're interested in the test, I should point out that we have a sale, Thanksgiving sale through the end, through Cyber Monday, where you can go to onetestforcancer.com, and we have a 30% off. So you can get the test on our online portal. With that, I thank you for your attention this afternoon and look forward to meeting anyone that's interested in the chat room.
Thank you, Jonathan. There should now be a poll up for 2020 Gene Systems. Next, this morning, we have iBite. iBite has created innovative dental wearable technology that enables a multitude of things such as location tracking, identification, and the facilitation of swift search and rescue operations. Please welcome Nicholas Fratantonio, founder.
Thank you. And let me tell you how a tooth can save your life. You'd be shocked to know that 35 million people go missing, lost, abducted, or trafficked every year, most of which are children. We have a solution. We dentists have been placing dental veneers for decades. All I needed to do was to place a nano microprocessor, embed that inside the dental veneer, and bond it on the side of a molar tooth in less than 90 seconds. Now we have the smallest, most secure, discreet personal safety wearable, capable of tracking and locating and data storage for health management. We have competition. We have iPhones, Apple Watches, AirTags, and hundreds of other devices. What sets us apart and makes us unique is iBite is undetectable. It cannot be lost or removed. It's 99% smaller than the Apple AirTag. It's self-charging, and it has fourth factor authentication and cannot be spoofed. In 2025, the wearable industry is estimated to be $77 billion and doubles every 4 years. This is the market we are going to penetrate. What we have accomplished, we're very proud that we just got our domestic patent issued in the US, and our international patents are all pending. I'm proud to announce my partner, Fred Carey, who's currently CEO of Idea Pros, and he has bought and sold several companies over his career. Between the two of us, we have 90 years of combined experience in health, technology, and security. In 2025, we project we can obtain and service 25,000 consumers, and our estimated revenues for 2025 will be approximately $4 to $4.1 million. We do offer a premium model subscription. This is a huge market with multiple scalability. We're clearly starting out with child safety, but there's a lot of opportunity in regards to pet safety and elderly care, which we'll probably institute shortly. We are asking a pre-seed raise of $300,000. That investment and capital will go to setup and manufacturing, package design, and software refinement. I thank you for your time. I'd love to meet you in my breakout room. If you're ready, let's go. Thank you.
Perfect. Thanks so much, Nicholas. And thank you, Sarah, for the introduction. There's now an investor pull up for iBite. And I just want to remind everyone who's on the call, please only answer these investor polls if you are a direct investor. So we have 5 more presenting companies, and to introduce the next 5 presenting companies, we have Mark Hawes. Mark is the CEO and co-founder of AEG, a leading alliance and membership organization of elite service professional advisors in the Washington, D.C. and Baltimore area, as well as virtually members include some of the leading business professionals in their respective regions. So Mark, please give us a few more details about AEG, and thank you so much for your support of CONNECTpreneur.
Right. Thanks, Skylar, and for Tien and Avery and Emily. I just want to say, continued participation in CONNECTpreneur is really a powerful aid to growing your own business, whether or not you're investing. So as Skylar said, we're really the leading community of mid-market CEO and elite business advisors in the DMV. And faced with accelerating speed and complexity of business, it's going to widen the gap between those who win and lose. And the winners are going to be one who have good access to data, capital, expertise, and experience. So, and you can't buy that time or trust. The answer lies in curated communities of leaders who deliver those resources. And that's what AEG is. We've created 2 communities, one of mid-market CEOs, and another of sort of top-tier business advisors from various disciplines. So the secret is that we handpick and cultivate and connect our members with an emphasis on building strong relationships rather than just transactions. So if you want some more information, I'll put my contact information in the book, in the chat. Our first presenter, or my first presenter, is NeuroEM. And if we think about with the aging population, Alzheimer is one of the fastest growing health challenges. And if anybody who's had a person in their family with dementia or Alzheimer's recognizes that there really isn't any cure or treatment. So, but NeuroEM has developed electromagnetic treatment that really gets at the core of the challenges in Alzheimer's. Let me introduce Amanda Patino as the Chief Marketing and Product Officer for NeuroEM Therapeutics.
Thank you so much. As the Chief Marketing and Product Officer here at NeuroEM, my favorite part of my job is being able to connect science and stories, and that is exactly what I'm hoping to do with you all here today. This is a story about Marty. At the age of 83, she was diagnosed with early stage Alzheimer's, and she's not alone. In the time that I'll be speaking with you today, 5 more people will be diagnosed with Alzheimer's right here in the US. For Marty and the 7 million other Americans living with Alzheimer's, there is no effective cure or treatment available at this time. The best that they can do is manage symptoms and slow down the progression. But these drugs come with some pretty terrifying side effects like brain hemorrhage and death. And while there are some legitimate therapeutic approaches that are starting to make some progress out there, there are also a lot that are really just snake oil claiming to have a cure. And unfortunately, they're all quite expensive. So without any treatment, the expectation was that by the age of 89, Marty would at best be in the late stages of Alzheimer's, not able to make decisions, disoriented to place and time, and generally unable to recall basic facts about herself and those that she loves. Now, had Marty received the best antibody treatments or drugs, she could have delayed that progression by a few months, buying just a little bit more time. Instead, her daughter enrolled her in our study, and this is what happened. Not only did our treatment stop Marty's cognitive decline, you can see here it actually reversed it. And a couple of months ago, I'm very happy to say that Marty celebrated her 90th birthday, and her most recent cognitive test scored within the normal range for adults in their 90s. So I did promise to connect science and story, so I wouldn't be here today telling you about Marty's story if I didn't also have the science to back it up. Our 8-person clinical trial showed the same significant impact, and the Western Independent Review Board deemed our therapy to present no significant risk. And while I did promise science, I can't give you too much science because I only have 4 minutes here, so I won't get into all of the details about how an accidental discovery led to a wearable cap using ultra high frequency pulses to break down toxic proteins and improve the key physical factors in the brain that are actually at the root of cognitive decline. And I also don't have time to tell you all about the 10 years of research, the 2 NIH grants, the 9 granted US patents, about how we were the first FDA breakthrough device status for treating Alzheimer's, and how we recently earned a spot on the Startup Health Alzheimer's Moonshot community. But suffice it to say, we have an incredible team making incredible traction towards transforming this groundbreaking research into a commercially viable reality and bringing this to market. And then just in case any of you are wondering how big that market really is, these statistics should show you everything that you need to know. The world is investing in the future of brain health, and it's just growing. So our plan isn't just to keep raising tens of millions of dollars for research. We have a clear path to profitability, which includes modest device sales goals that will become the economic engine that we'll use to fund our continued research and development for new applications of our technology. We do have a clear vision of the future, but as our CEO likes to say, there's a fine line between a vision and a hallucination. So we put together a team of experts to help make that vision a reality. And now we are focusing on commercialization. We are looking for mission-aligned investors who can help us take this to market. And if you're an early stage investor, we've opened our first institutional round led by Stage 1 Ventures. So while this has been a story about Marty, it really has been a story about time and the extra time that NeuroEM can give to the families of Alzheimer's patients. So I'll leave you with this quote from her daughter, and I look forward to talking with all of you in the breakout sessions.
Great. There's a poll up now for NeuroEM Therapeutics. Our next presenter is Ovala, and Ovala is looking for investment to address the issue of stress urinary incontinence. They already have a product in the market with FDA approval, and I think it's a different kind of treatment. I think a lot of people appreciate how easy it is to use and how effective it is. I'd like to introduce Steve Bollinger, President and CEO of Ovala.
Hey, good morning, everyone. Ovala is a medical device company focused on women's health. I've been blessed. I've sold my last 4 medical companies, and the last one was a solution for an over-the-counter infertility product, which triggered building Ovala. So what is Ovala? We're focused on a disease state called stress urinary incontinence. Every time you cough, sneeze, or dance, you tinkle in your pants. The connective tissue can no longer support the urethra. So why? What is the cause of this? Age, childbirth, obesity, smoking, high impact activities is a physiological opportunity to solve. Equally important is the psychological impact. These women have a reduced quality of life, a diminished sense of freedom, and a fear of social embarrassment. So how big is this marketplace? 1/3 of all women between 30 and 60 have this, and 80% are more likely to develop clinically diagnosed depression. So that population, every year, 18 million women are diagnosed by healthcare providers that have SUI. Additionally, pelvic organ prolapse, there's 23 million women over 50 that are diagnosed. So everybody knows someone with this disease state. So what's standard of care? Pads, liners. It's a $2.2 billion US marketplace. They're odorous, they have discomfort and chafing. And under a healthcare provider, pessaries are the next stage of defense. They have poor compliance, and women can no longer have intercourse with them. There's no drug therapy. Physical therapy has poor compliance. It's a long path and has slow results. So the last solution would be surgical intervention, which, as you may know, have had a high complication rate and have a low long-term satisfaction. So what we've done is taken a medically proven approach, pessaries, through innovation, taken the technology directly to the consumer with a product called Revive. It's a class 2 medical device, and we're already through the FDA. We have both RX and an over-the-counter authorization to market. It's simple to use. It's tampon-like insertion, placement, and removal. And how it works, the uniqueness of the mechanism of action is that it uses the unique physiology of the vaginal structure with a dual ring and a distal taper on this product that allows one size to fit most. So how does it work? Its package is a 1-month supply. What should be reusable is reusable, and what should be disposable is disposable. So the woman gets up in the morning, places it intravaginally like a tampon, dry all day. At the end of the day, she pulls it out like a tampon, throws out the string, washes it, and she's ready to go for the following day. So the patient only uses about $1 a day for their cost. There are 3 unique distribution models. Today, we're online and in commerce on Amazon, Walmart.com, and our own website. We're expanding into HCP, healthcare providers, and hospital systems today because there are CPT codes and reimbursement codes that these individuals can actually make income. And then the reason for the capital raise is to expand into retail into Walmart, Target, and several other unique retailers. We've already sold over 100,000 units. We have 2,500 reviews on Amazon, and the feedback is it changed my life. We manufacture 100% United States. We have over 76% margins in retail. We have a complete worldwide utility and design patent portfolio, both on the pessary and the introducer. So we've tried to de-risk and stage for growth and for impact today. It's a $200 million standalone category with incontinence and 2 times that upside on prolapse. We've successfully navigated the FDA, where physicians and physical therapists recommended. We have consumer acceptance. We're in revenue. We have a product line extension ready for launch, and we have multiple strategic partners in discussion today. What's interesting about our device is once you're a user, we have you for long-term retention. So today we're raising a Series B, $10 million capital raise to formally market launch to build awareness and drive for liquidation. We're offering a convertible note for early investors this year with a 25% discount and a 10% interest. The opportunity is about 18 to 24 months. We expect to exit since we have strategics around the table. So I hope to meet you in the breakout room. If you're interested in making a difference and having a real impact product, we have something available for you today. Thank you.
Thanks. We have an investor poll is up for Ovala. Our next presenter is Quasi Robotics. When we think about autonomous vehicles, we think about robotaxis and personal cars, but think about all the products and parcels that need to be moved around. Amazon's moving 5 billion packages a year. It'd be great if there's a tremendous opportunity to automate this process. And so Quasi Robotics has developed an incredible solution for this. Please welcome Elena Shimova, Marketing Director of Quasi Robotics.
Thanks so much, Mark. Good morning, everybody. So at Quasi, very simply put, we are building mobile robots that we hope will deliver items across facilities. And so we're trying to eliminate the issues that businesses often have when they rely on manual labor for the simple and repetitive tasks of moving items, whether that is through transporting products between workstations, or it could be sending out from like a major supply room in the middle of their workstations to other places that requested it, or any other type of material transport that is currently being done by humans as opposed to something that could do it for them. And so we're all familiar, of course, with the general purpose utility cards. They tend to be inexpensive. There's different shapes, different sizes. They're used everywhere. And I'm going to play this video that we have here. And everything is fine with them, but the main issue is that the person still has to manually push the cart. And sometimes that means quite a large distance. In a big facility, that could be results in miles of walking every day, of pushing a cart per day. And that means that you're using company time and money inefficiently. So the solution that we've designed, there we go, is the Model C2 robotic cart. We're hoping that this cart is going to deliver supplies and materials autonomously. When I say hoping, that's a very like generic term. It does. So that is why we developed the Model C2. Basically, very simply, it's a robotic cart. Its main purpose is to automate supply delivery. We've made it incredibly simple. It can be deployed in 30 minutes, but we've also included highly advanced AI software behind it. And that's to make sure that it can be highly customizable and reliable. And then on top of that, on the very, very back end, we've included the Cloud Connect software that is going to do the data management and the business intelligence that you guys need to make sure that your business is moving in the right direction. So it turns out, since we've launched, the market for our solution is quite big. We place ourselves into the automated intralogistics and material handling market as of 2024. That is 63.4 billion with a 14.4% growth. And then given the market being that size, we definitely do have some competitors, but they're usually falling into two very distinct categories. Either they're going to be expensive, complex systems that take a while to deploy, a while for you to find the ROI, or they're going to be very basic and flexible robots that have limited capabilities, that can't do data collection, that can't do anything that you need to make sure that your business progresses forward. At Quasi, we're taking a different approach. The Model C2 is going to match the price point entry, so the entry level of the easy solutions. So basically, they're going to be, it's going to be built from the ground up with customization in mind, which means that if a customer needs to have shelf dividers, or if they need to have certain software integration abilities, we have the know-how that's going to modify their product to modify the hardware and the software on our part to make anything possible. And that's the key advantage of us. Now for traction, we went to market with the Model C2 around September of last year. Since then, we have had really promising growth. We've deployed 7 robots since then. We've secured 3 distributors in the US and Mexico. We have 5 patents in the work for the design and utility of our products. And then for our team, we have 3 founders currently. And they share over half a decade of experience in robotics, programming, and artificial intelligence. And after they worked together for 20 years previously, they have already been able to sell a growing company from the ground up, which resulted in 2 previous successful exits. Which brings us to our financials and our asking point. And currently, what we're working on is having the funds to fulfill our orders. We're invested heavily in procuring the components that we need for several promised orders. Despite this, we still do project profitability by the end of the next year, so by 2025. So what we're asking for today is, what we're asking for today is going to be $1 million that we're planning to use for the funds of purchasing parts, labor, and equipment that we need to fulfill these ongoing orders. And with that, we'd love to discuss that further with you, with the Quasi CEO. We'd love to see you in the breakout rooms. Thank you guys so much.
Thanks, Amanda. There's now an investor poll up for Quasi Robotics. Our next presenter is Scout. And think about, I guess it's been a couple of years now that college athletes have been able to, sell their name, image, and likeness. But you can imagine somebody that young without the experience or the financial acumen to be able to manage the amount of money that's coming in. So I'd like to introduce Michael Haddix, the co-founder and CEO of Scout. He's going to tell you how we're going to solve that problem.
Awesome. Thank you. Good to meet everybody. And we'll jump right into it. So I'm Mike Haddix. I'm the co-founder and CEO of Scout. For quick background, I'm a former Division I college basketball player. My dad was the number 8 pick in the '83 NFL draft. I went to Columbia for business school, was an investment banker at Lazard and Goldman, and then actually managed money at Octagon. We had about $1 billion under management, players like Chris Paul, Steph Curry, Giannis, Michael Phelps, and Martin Hingis. So I've seen a lot of different sides of this and been in and around it all my life. So the problem right now, athletes are making more money than ever with less financial experience than before. Schools can be held liable for issues with players. They're paid as 1099 independent contractors. A ton of money is being infused in the system, and revenue sharing starts next year. So right now, players are making money through their NIL, which is outside of the school, but Judge Wilkin just approved the settlement, which means next year schools can invest up to $21 million are going directly to the players on top of NIL. So now you have schools figuring out how they're going to make these payments. The money's getting bigger, and there's a big opportunity here to be a fintech solution in a completely new industry that didn't exist 3 years ago. The solution doesn't currently exist. That's why we built it. We're the first mobile financial support system for athletes. Our V1 product, which is live in market, we have about 13 schools on platform now. It does taxes, money management, financial planning, investing, saving, all these different pieces for those players. And they have a chat feature where they can text the app for any financial question to help them navigate their financial journey. So we're the only ones that do what we do. And the big piece is because these players are independent contractors, that tax component is a really big driver right now of the business. NIL is the fastest growing industry in sports. It'll be $33.8 billion by 2028, and $5 billion is going directly to the athlete. So this money is going right in the pockets of 19 to 22-year-olds. If you think about from a business standpoint, really high LTV, underbanked population who really doesn't have any financial experience or support, and we are getting them really early before they have any real relationship with the financial institution. How big is the opportunity, right? There's 362 Division I athletic programs, about 1,000 if you look at D1, D2, D3, over 500,000 current athletes, and 30% of them are replaced every year. So every year, 30% graduate, and then their seat is filled. And our first product is tax returns. We'll charge about $5 for tax returns. We have a software that costs us $20 per tax return. That's a $150 million a year business right there. So about how we make money. So we're a B2B2C business. So what we actually do is we charge a flat rate for the school to license our software. So for the V1 product, schools will pay between 50 and 100 grand just for the flat rate of that platform. Now we talked about revenue share happening next year where schools have to distribute up to $22 million on top of NIL directly to players. And they're looking for a payment processor to help them navigate that. Now, if you make any money from an athletic institution or sort of school in general, in your 1099, there's vendors, there's purchase orders, and they can't do this for 500 athletes 6 or 7 times a year. So they're looking for somebody to distribute the funds with the willingness to pay them 1% to 2% of that. You're looking at almost $500,000 for that piece of it. And then the long tail of this business, we're B2B2C. So we're paid by a school, and then we acquire these users and we charge those players. We make money when we do a tax return and when they invest. We have a credit card, which we get 1% of interchange exchange. So now we have all these different financial products like a SoFi or a NerdWallet that will then make money on top of that as well. So we have 10 when we made these slides. We just signed a couple more schools. We have 13 now. We're about 600,000 in revenue this year. We'll be at $1 million by the end of the year, about 1.1 million in the pipeline right now that we expect to close in the next month or so. 2,500 athletes currently live on platform, and all that revenue that we have is coming from the school. So that's the B2B portion. We'll start monetizing those players individually next year. And our schools include places like UCLA, Tennessee, San Diego State, Oregon, Auburn, Mississippi State, Iowa, Texas A&M, some pretty large programs. So projections, right? So we look at what we make from athletic departments as one piece of it, 100 to 500K per year. We look at 500 to almost $100,000 from athletes, right? They need a lot of different things: solo 401Ks, SEP IRAs, because they're 1099s, their taxes done. And then we're becoming a brand in the space. So we're looking at 50 to 100 grand per year in terms of the branding part of the business. Partnerships, we're expected to do about 300 million in revenue, a little under in the next 4 years. We're raising 3.5 million. We have 2.5 million already in the bank. That gets us to $3.3 million in ARR by the end of next year, 20 conference school partnerships. And then we already have a one conference partnership that we're looking to expand. Next year, the focus is really on that B2C business, and we're the only show in town, and we're really excited about what we're doing. I think my time is up. So I gave my background. I think we're over time. But thank you. Look forward to talking soon.
Thanks, Mike. That was great. We have an investor poll up for Scout. And before we go to our final presenter today, just want to remind people that AG is having a virtual networking event. I'll put the information in the chat. I see some people have signed up already. Last presenter is Ship Thrifty. And if you think about, we're heading into the holiday season, and you're going to think about standing in line at UPS or the post office. It would be great if you could just do this all from home. The problem is not everybody has printers, not everybody has access. So Ship Thrifty has come up with a solution to that just in time. Please welcome Rob Williamson, owner and co-founder of Ship Thrifty.
Hi, everybody. I am Rob, and we're Ship Thrifty. We build technology for overlooked markets. And for us, that's all about people. So if you look around you, self-service technology is the future. And you probably have 4, 5, 6 apps on any of your devices right now. And we saw that back in 2017. We asked the question, if I can create my airline ticket online, why can't I ship a package? And so we looked around and we built Ship Thrifty after surveying that market. And as we were about to launch, a friend of ours was being deployed, and he told us how bad military shipping was and how difficult and scary it was. And so we talked to groups that do this and organizations that send care packages, and we realized it was that bad. And so we built a military shipping tool that has all kinds of special features. And over the course of the past 6 years, we've worked with thousands of military, consumer, nonprofit, and business shippers who love our tools. And so along that journey, we've earned really coveted military partnerships at a national level, and they have reached to millions of members, and that's blossoming. But we've also made the whole process of military care package shipping turnkey for organizations, whether it's a civic organization or a company as a team building event or a church. We've worked with them all, and we make it really simple. And so during all of this journey, one of the things that we did was listen very intently, because 3 big opportunities were revealed by our customers. So the first thing is 3/4 of a ship in person at the retail store, whether it's a post office or a UPS store. But yet we live in this technology world. And so there's a huge opportunity as $6.5 billion shifts to online label creation. And we have 2 solutions. One is shipthrifty.com, and the other is what we call a shipping button, which is a lot like a chat button, only it sits here, and one of 350 million website hosts can brand it and offer their audience shipping right from their website. It's great for a lot of different things. And then the second thing our customers helped us to understand is small nonprofits and businesses simply can't win in doing online. If you are a plumber from Albuquerque, or you volunteer your time at a Red Cross for 5 hours a week, and they want you to do online stuff, there's no way you can wade through this sea of 11,000 plus tools. It's just not possible. So for our nonprofit customers, we built an all-in-one platform that allows these underdogs to reach, drive revenue, and ship online. And if you can type, and if you can upload an image, you can do all of these modules, and each can have multiple sort of posts underneath. and they can be shared across all these existing social media platforms. So you get a lot of leverage that you don't have with just a Facebook. So the third thing that we see and hear every single day is people can't print their labels. Well, why is that? Well, because 56% of Americans don't own a printer. And as we're all migrating to the online version of shipping, they're going to need a place to print this stuff. And so we're building a network, a partner network of local label printing kiosks. So whether you buy your label from Ship Thrifty or FedEx or Shippo or any of those, you're going to be able to go to a local station, scan a code, upload your labels, and print them right there. Very simple. So putting it all together, these three technologies are really designed to be a flywheel, and they connect us to about about 45% of the population. And what that does is creates countless customer and partner acquisition points. And as they come in through one of the technologies, it actually becomes a sticky web of cross sells. And so they learn about our other products. And we see this happening today and have for years now. And so it's a perfect time to join us because we've self-funded, about 9 of us, and incubated this through all the hard, time-consuming, and expensive stuff. We've got a great team on and pending and ready to go, and capital drives that growth. And so you can see that we're raising $1 million. We've got about half of that closed, and we have a great 5-year projection. I look forward to seeing everybody in the breakout room. Thank you.
Perfect. Thanks, Rob.
Thank
There's
you.
an investor poll up now for Ship Thrifty.
Perfect. Thank you so much, Mark, for the introduction. So Ship Thrifty, as Mark mentioned, the last investor poll is up for them. And momentarily, we will be opening up breakout rooms. Each of the 11 presenters will host their own breakout room. So we ask that you please be respectful in those breakout rooms as they are for the presenters to connect with direct investors. So please leave that time open for them. And we are going to put up one more sponsor poll just in case you missed it in the beginning. If you already answered it in the beginning of the meeting, no need to answer it again. But if you missed the beginning of the meeting and did not get to answer it, please feel free to do so now. This is just a poll for our sponsors. If you are interested in any of the following services, please feel free to indicate that here. And we will leave this up for a little while as we move into breakout rooms. So with that, I would like to remind everyone to save the chat. Please make sure you save that chat before entering breakout rooms. And Tien will open up those breakout rooms now. And you'll see that breakout rooms button open at the bottom of your screen where you have the audio, video, share screen. Now you'll see another button that is set called breakout rooms. So please click that and click the breakout room that you would like to join. If you have any trouble getting into a room, please just direct message me in the chat which room you'd like to go to and I'll help you get in. But all of the presenting companies, please now go join your breakout room and we will talk to you all soon. These breakout rooms will be about 30 to 45 minutes or so. So everyone enjoy the breakout rooms and we appreciate you all being here today.